Hi there, and welcome back to a special edition of Great Day Live here at GenCare Senior Medical Center on Hikes Lane. We've been talking about, all the different ways that Humana and GenCare are focused on creating really positive health outcomes for people in and around our community. And when it comes to medical care, obviously it can quickly and very easily become pretty overwhelming. But GenCare Senior Medical Center can serve as somewhat of a one-stop shop for all of your medical needs.
Our GDL's Joanne Dixon stopped by another GenCare location to learn all about the services they offer. Check it out.
I am here this morning with Dr. Sheila Kemper at one of 4 GenCare Senior Medical Centers in Louisville. Now, first of all, Dr. Kemper, who is GenCare Senior Medical Center and what do you do?
So we're actually a family-owned primary and specialty care practice that's dedicated to delivering superior health care to Medicare-eligible seniors. We were actually founded by Dr. James Chen after he was diagnosed with cancer and had a really frustrating experience with the healthcare system. He recovered from the cancer and went on to make these medical centers that are top-notch. Our centers are led by physicians that are not only compassionate, but they are experts at detecting and managing high-risk diseases. We have 4 centers in the Louisville market, and if you're turning 65 or if you're eligible for Medicare, it's really important that you have a doctor that understands healthcare for older adults. Here at GenCare, we make that medical care accessible and convenient by providing a lot of on-site services like labs, x-rays, EKGs. We do heart ultrasounds, we have on-site specialists, we dispense medications and provide transportation to our patients at no cost to them.
That is so fantastic because someone doesn't have to go a bunch of different places. It can come like a one-stop shop for everything that they need. Yeah. And how does GenCare Senior Medical Center help its seniors stay healthy?
So at GenCare, we really believe that the doctor-patient relationship is really important for good medical care, and we are mission-driven to restore that relationship by reinventing preventive health care for older adults. Our model is patient-focused and high touch. That means that our doctors have smaller patient panels. So when our doctors have smaller patient panels, they have more time for you. Our patients get about 10 times more face time with their doctors than the national average here at GenCare. And this high-touch, patient-centered model, combined with a focus on prevention and frequent visits, leads to better outcomes. Our centers actually have a 33% fewer ER visit and hospitalization rate than the national average for Medicare beneficiaries.
That really is incredible. And how does GenCare help address the health needs of seniors?
So seniors are really vulnerable because a lot of times they have multiple high-risk conditions going on at the same time. A lot of our patients have 4 to 5 chronic health issues. Some have had very limited access to care before coming to us. They would use the emergency room or hospitalizations as the only time they'd see a physician. So disease detection is really important in these patients. And here at GenCare, at the very core of our model, is what we call the Pcp Led Care Team. And this is a care team of care facilitators, care coordinators, care promoters, that's all led by the primary care provider. And this team not only delivers VIP service to our patients, but they are experts in detecting high-risk diseases like diabetes, hypertension, chronic heart failure, chronic lung disease, mental health issues. They detect these diseases early and provide early management, and that early disease detection and management leads to better outcomes. We actually had a study published in the American Journal of Preventive Cardiology in 2020 that showed that our patients who have benefited from our care have a 40% lower risk of mortality with COVID just by getting that high-touch early cardiovascular risk modification that they get here at GenCare.
Dr. Kemper, thank you so much for talking to us this morning.
Thank you.
And you can learn more at gencaremed.com. For Great Day Live, I'm Joanne Dixon.
Coming up, the relationship between you and your doctor is critical. Up next, how to find a primary care physician and ensure the relationship is just right.
So I've been a patient at GenCare for about 7 years. Being a patient at GenCare, you know that they're giving you quality care. They have all these doctors in one place, which is really convenient for everybody. They make you feel comfortable. The doctors really sit down and take their time with you. It's not a rush, you know. They want to know how's everything going, what can they do to make it better if you know, if possible. You don't hear that with a lot of offices. So it's really a caring place to be, and I wouldn't want it any other way. And this is what you get when you walk in GenCare. So if I had an emergency, which I can really say I literally had yesterday, I was able to call the number at GenCare. The answering service answered. A doctor literally called me back within 3 minutes. So this was a process, you know, literally just minutes apart from each other. Her calling me back, and she said, I'm gonna stay on the line. So, you know, just knowing that she took that time to do that just made me feel better about, you know, being here. And this is the process that they do. So I really enjoyed that. Quality care is all about GenCare, and GenCare is quality care. And I would tell anybody, come on in, try 'em.